Well, hello, everyone. Welcome to today's annual election period Priority Health Medicare Advantage Plan seminar. Today, we will be talking about what those plan changes are. I also want to go over just a few little reminders of things that are built into your plan and talk about some new CMS rules that have been put into play. So here we are in our busiest time of the year. Of course, many of you are aware of what those dates are, but that annual election period for your Medicare Advantage plan is going to be October 15th to December 7th. And then, of course, if you make a change or if you're newly coming aboard or whatever, your plan will be effective January 1 of 2024. If you do nothing with your plan, it'll just roll over into this next year. So it renews annually. And then again, this is the one time of the year that you can make a change to your existing Medicare Advantage plan. We'll talk about a few benefit reminders and then really focus on those 2024 changes and highlights. So here is our Medicare team. Of course, you all know Nancy, and then myself, Kristen, is in the back there. And then on the right, we have Amy. Amy is going to be our priority health guru this year. So that was kind of the role that I had last year, where I took a huge chunk of our priority health clients because we have so many of them. And Nancy herself, I mean, she just can't keep up with everyone because she has so many clients now. So we're here to be that support to you guys and help you as well. Our newest member is Becca, and Becca is going to be helping with our administrative side of things. So starting right out of the gate, which you may have all received numerous means of contact from us, whether it was through email or maybe we mailed something in the mail or in our newsletter, but there are some new rules that are being put into place for 2024. So CMS comes in, and last year they made us record all of our phone and Zoom calls. That does not change. That's going to continue to move forward. We, however, don't have to record in-person appointments at this time. But the biggest thing that they made a change to for this year is that the scope of appointment form, which is a government form that we have to have on file. It's good for a year, but we have to keep it for 10 years. And we have to have that for auditing purposes. So before, it used to be, we'd be face-to-face and you could sign it then. It's stating that we're speaking about Medicare or whatever items you wanted to talk about, and that we weren't selling you something that you were unaware of. So now that form is required 48 hours prior to your appointment. So that's why we have kind of changed our processes, and we're trying to get that form proactively. So if you haven't already submitted your form, please do so. It'll be good for, like I said, for 12 months from the date that you put on the form. And then we wouldn't have to cancel an appointment if we didn't have that. So we also have an updated disclaimer that CMS is requiring us to do. This, I'm sure you're a little bit familiar with from last year. Some of the verbiage of this has changed, but when you go to call in, or if we have a Zoom call, this is the verbiage that you're going to hear, unfortunately. So just bear with us, and we're just following the rules so that we do everything right. And then this is like in our email signature line and whatnot. Again, if any of you have any questions, I know a couple of you popped in after I had said this before, but please type in the chat box. If you can just stay on mute, that would be great, because we're going to record this and put it online. So the Medicare Advantage Plan reviews. So just a quick little recap from the top is that the Medicare Part C comes in and it replaces Parts A and B. Plus, it's putting your prescription drug plan, the Part D, added in one. So it makes it like a one-stop shopping, right? And you have those extras that are built into your plan. So you have your preventative dental, vision, and hearing, things like over-the-counter benefits. And a lot of those benefits we'll be talking about here in a little bit. The plans that you have, they're not Medigap plans. So you don't have a Medigap plan with a separate Part D. Yours is all encompassed in that one-stop shopping as a Medicare Advantage plan, or known as Part C. They are managed care networks, so HMO, POS plans, and PPOs. It's all about remaining within your network to get the most out of your plan. So that's why we want to make sure that we look up your doctors and make sure that that's coordinated so that you get the most out of your plan. These are lower monthly premium plans, and as you all know, when you go to use your plans, when you go to use services, you have copays, you might have deductibles or co-insurances that need to be satisfied. And then again, on with this, just a review, is that all of your plans have a maximum out of pocket for the year. This is going to clearly vary by plan how much it's going to be, because not all of the plans are $0 monthly premium plans. Some of them do actually have a premium. So the higher the premium, then the lower the maximum out of pocket. Most of our clients do not meet the maximum out of pocket for the year. That's really something catastrophic has happened. But that is just what you know is going to be your worst case scenario. And then most of the plans, all of these plans we're talking about today, the Medicare Advantage plans with Priority Health, they all include the Part D prescription drug coverage built right in. And also that worldwide emergency and urgent care services, that's on all of your plans, giving you the flexibility to travel. Some of those other additional extras, when we talked about that preventative dental, vision, and hearing, the over-the-counter, we're going to talk more about that in a little bit. The health club membership is through Silver Sneakers. Hopefully you guys are using both of those two options, the over-the-counter and the Silver Sneakers. I know a lot more gyms have joined on with that. And in our local area, all of the MVPs are now on that. So yeah, any feedback that you guys want to share about that too, feel free to put it in the chat box. Some of the plans, or actually one of the plans, has a Part B give back or credit, if you will. And so we're going to talk about that one a little bit. And even some have transportation. So if you are having a hard time getting from home to a doctor's appointment, or you need help with transportation, there's a plan out there for you. And then some of them include that mom's meals following a hospital stay. So all of the Priority Health plans for this year and for next year, they have a $0 medical deductible in network. And then of course, it's always going to depend on what your monthly premium is based on the county and zip code in which you live in. There are 10, we're focusing today on region 1. So there are 10 plans that are available in this region. And then again, back to those network choices, right? So there's 6 PPO plans, and then we have 4 HMO POS plans. These plans, whether with Priority Health, the Medicare Advantage plans, they receive a star rating. And so that is determined by CMS each fall. That star rating comes out. And the star rating is given by customer service, how well the plan is working and servicing people. The higher the star, the more money that the carrier is getting to then build these plans. And so for this year, Priority Health for 2023, their HMO POS plans did receive a 5-star rating. And kind of the beauty about that is that you can move to a 5-star plan at any time of the year. You don't have to wait for these special election periods like AEP or an SEP, which is a special election period as well. So that's kind of the nice thing about the 5-star. And then the maximum out of pocket limits, they of course vary by plan, but this is the range of what these plans have right now. And then the prescription drug plan is built into all of these. Again, we want to remind you the worldwide coverage for emergency and urgent care. So no matter where you are, you can go and seek care. If you're in another country, if you're just in another state, please go and use that because you're going to pay in-network copays. And then in-network copays in the US and outside of Michigan's Lower Peninsula That is on the plans. You have no referrals are required to see in-network providers. And then again, we'll speak a little bit more as we move into the presentation, just about what the preventative dental, vision, and hearing is, and any changes that have had been made to those, and then the over-the-counter in the gym membership. So lots of added value benefits. So we're just bringing those up again, just as a reminder so that you're using those. So for 2024, one of the first changes that we want to talk about is the emergency care and observation copay on all of the plans across the board. It went up a little bit from the 110 to 120. And then, and a side note too, I know that we had emailed out the outline and additional documents, but there's a good comparison sheet in there. And again, this is all for Region 1, but most folks that were on this are going to be in Region 1, but these variations of the differences between what last year looks like to this year, that's going to be in there. And then it also gives you all of the plan information. So you have a good comparison to see the differences. The cardiac and pulmonary rehab copay has decreased to 15 on most of the plans. And then new to this year, all of the plans have some form of over-the-counter benefit. The annual wellness visit is now available. You can actually get it. So before it was only basically like once a year or an 11-month period, but now you can actually, you could get one now and then you could get another one if you needed to in February. So they're not looking for that 11-month period anymore. And then one of the big ones is Meyer. Meyer is now part of the OTC purchasing. So I know this past year that they switched vendors with their OTC, and it did not kick off as smoothly as they wanted it to with Priority Health. And Priority Health acknowledged as well, and they've worked out the kinks. And they'll continue to work out kinks as well. But the reason why they made that change to that vendor was because they knew that Meyer was coming on board. So now we get to announce that. So your over-the-counter purchases can be through Meyer as well now. And then for the last bullet here, the $0 prescription copay. So now if you have gone into with your Part D plan with your prescriptions, if you go into the donut hole and then you get even into the catastrophic phase, once you have paid $8,000, you then will pay $0 for the rest of your prescriptions, where before it was 5% that you still had to pay. So for Priority Health, Region 1, these are the counties that are considered to be in Region 1. So if any of you on the call are not in one of these counties, we can definitely, you can give us a call and we can talk about what that looks like. But majority of the people were in Region 1, so that's why we've selected this. Our $0 premium plans, for the most part, these all stayed the same from 2023 to 24. It's going to be these 4 plans have a $0 copay. You obviously still need to continue to pay your Part B monthly premium. So keep paying that and then you'll keep having this plan. The one plan there at the bottom, that one is only available in Kent and Ottawa, and then a couple counties on the east side of the state. But for now, we at least have it here in Kent and Ottawa, but that plan was new for this year, for 23. So now it will be its second year around. And then some of those plans in Region 1 that have a monthly premium, again, these are the same counties. The monthly premium, it went down on most of them. And then the select, that's kind of more it's the highest one, of course, you can see, but that one just remained the same, given if you were in this region. But the other ones all went down a little bit. So if you have a monthly premium, then the likelihood that you have a lower maximum out of pocket, that might be true. All of those HMO plans, there's a couple here too, that those received the 5-star rating as well for 2023. And the 5-star rating, back to that slide that I had mentioned, the 5-star, it's not out yet. So we should hopefully soon be receiving that information, and hopefully Priority Health still has the 5-star rating. And now I'm going to pass it over to Amy. And these are some of the sheets that we emailed out to you guys showing some of the comparisons.
We'll just change places here. Hello, everyone. So the comparison that you can see on the screen, just to point out, this page is a 0 premium plan. And if you look at anything that's bolded is a new change for 2024. The information in the parentheses is what is current for 2023, and the bolded information is for 2024. And then we also have the same kind of comparison sheet for the premium plans. These two sheets are really kind of a high-level snapshot. There is another list is also included in your packet that we emailed out. That gives you a little bit more detail on each of the plans, information about some drug and prescription co-pays as well. So between the two, you'll be able to really get a good comparison, see a really good comparison between the plans. So now I'll just kind of give you some highlights of each plan and the key things that have changed. So for the key plan, that's one of the HMO POS 5-star plans for 2023. And hopefully it'll stay that way for 2024, but we don't know yet. But for the key plan, the inpatient hospital changed. And typically on all these plans, when they've changed this year, the daily amount went down, but then the number of days went up. So what that means, for example, on this, for the key plan, $320 per day, down from $325, and you'll pay that for days 1 through 7 that you're in the hospital. If you're still in the hospital on day 8, then your plan picks up at 100%. The over-the-counter benefit for the key plan went up to $100 per quarter, up from $80. And just a reminder that that is use it or lose it. So if you don't use it in a quarter, it does not roll over. The other thing that Key added this year is something called OTC Plus. And what that is that allows folks who are eligible to use their over-the-counter allowance to buy healthy food and produce. And to be eligible, really you need to have a chronic illness like diabetes. There's certain cardiac conditions. I believe they've added obesity to the list. And really, Priority Health will help let you know if you qualify for that. And if you do, then you're eligible to use your OTC allowance to buy food. And again, that includes Meyer now that they are on the system as well. The other thing that the Key plan has is an additional comprehensive dental benefit. And this is one of the big changes for this year. In 2023, it was $1,500. And for 2024, that allowance is going to be $2,500. So that's a nice increase there. And then if you did want to purchase the enhanced dental and vision on top of that, that premium per month went to $33, up from $29. So while the Key plan itself doesn't have a premium, it's a $0 premium. If you did add the enhanced dental and vision, you would add a $33 per month. Edge plan is a PPO plan. Their inpatient hospital per day went down to $320 from $350. But the number of days went up to days 1 through 7. So again, days 1 through 7, you would pay $320 per day. Starting on day 8, the plan would pay 100%. The over-the-counter allowance for the Edge plan went up from $60 to $95 per quarter. And a feature that the Edge plan has is Priority Care or Papa Care, and that is something that that clients use to help with light housekeeping or maybe grocery shopping. They can even provide technical support if you're having issues with your computer or getting your Wi-Fi set up or something like that. It's just a nice feature. So they did decrease the number of hours per year from 72 to 48. And the reason for that is they looked at how much members were actually using the Papa Care, and they realized they weren't really using the 72. So by reducing it to 48 hours per year, that allowed them to increase benefits other places. So it's kind of a chess match a little bit. If we decrease this here, we can increase this somewhere else. And it may be why the OTC went up by $35. That's a nice jump. But they did look at usage before they made that change. And the enhanced dental and vision package that goes with the Edge plan went up from $38 a month to $42 for 2024. The Vital plan, this is a PPO plan, and this is the plan that Kristen mentioned earlier that has a $30 per month Part B credit. So you will get $360 per year on this plan back from your Part B premium. It is an open network, and what that means is you have the same cost share whether you're in network or out of network, and so that gives you just a little bit more flexibility. And that does not matter if you're in the Lower Peninsula or not on this plan. The maximum out of pocket for the Vital plan went up from $4,900 to $5,100, and the OTC Plus went up per month, $20 from $20 to $30. Again, there on this plan, it's per month, and it does include OTC Plus. The Vital plan also has, much like the Key plan, the comprehensive dental benefit that went from $1,500 a year to $2,500. There's another nice feature of this plan for those who need hearing aids. While all of the plans have hearing coverage, the Vital plan provides 2 hearing aids per year, 1 for each ear, at no cost through True Choice. So that is a really nice benefit if that is something that you need. Excuse me. And the enhanced dental and vision on this plan went from $29 to $33. The One plan, which is the newer plan that Kristen mentioned earlier, it's one of the 5 stars. It's with the HMO POS. Their inpatient hospital did not change. It's still $285 a day for days 1 through 7. And the OTC Plus went from $15 per month to $26. Sorry, I'm going to grab some water. This plan also has the Papa Care. And it used for 2023, there were 100 hours. For 2024, it's down to 72 for that same reason they looked at how members were using it. The really nice feature of this plan is that transportation. And they provide 30 one-way trips up to 40 miles if you're going to the doctor from your home to your doctor or any other health-related travel. It's powered by Safe Ride. It does include wheelchair transportation. So this is really nice for folks who have a hard time getting around. And they contact you, they let you know who's coming and what time. And you can set it up, I believe, 24 hours in advance. I think they want a little bit more time if you need the wheelchair assistance, but that's just a really great feature of this plan. And then the enhanced dental and vision with this plan went from 38 to 42. Sorry, I have a tickle. Okay, the value plan. The value plan is one of the ones with a premium. Again, this is $12 premium for next year. There's not a lot of change with this plan. Their max amount of pocket stayed at $4,900. Inpatient hospital, no change, $325 a day for days 1 to 5. The OTC allotment did go up from $25 per quarter to $40 per quarter. And like all of the plans, the emergency room and observation increased from 110 to 120. And their enhanced dental and vision is $42 next year per month. And there's just we'll just kind of go through some of these other premium plans. The Ideal plan, same thing, not a whole lot of change. Just kind of just shows you what this plan has: a $5,800 maximum out of pocket, $300 a day for days 1 through 6 in the hospital. OTC went up just slightly. This plan does also include the Papa Care, and the enhanced dental and vision package is available at $42 a month. Merit plan is a PPO plan. Their maximum out of pocket did not change at $4,100. Inpatient hospital remained $375 per day for days 1 through 5. This is one of the plans that did add the OTC benefit this year. It's up from $0 to $25 per quarter. And the enhanced dental and vision is offered at $42 per month. The Medicare plan, this is one of their longest plans for Priority Health. It's an HMO POS plan. It's been around quite a while, and it has a maximum out of pocket of $4,500. Inpatient hospital is pretty low at $225 a day for days 1 through 6. And the over-the-counter is at $40 per quarter, and enhanced dental and vision can be added to this plan for $42 a month. And lastly is the Select plan. This is the most expensive plan. It's $157 a month premium. But you also see with that, you have a $3,500 maximum out of pocket. So it's also the lowest out of pocket, maximum out of pocket for all the plans. And also the lowest inpatient hospital at $200 a day for days 1 through 6. The Select plan now has $25 per quarter of over-the-counter benefit, and the enhanced dental and vision is added at $42. Let's just talk a little bit about your Part D prescription drug coverage that's built into your plans. The Vital, Value, Ideal, and Merit plans do have a prescription deductible. The rest of the plans do not. But these plans that do have the deductible, it only starts at tier 3. So if you're on tier 1 or tier 2 medications, the deductible would not apply. But tier 3 and up, it would. The way the formularies are structured is that tiers 1, 2, and 3 are copays. So those are set dollar amounts that you can count on. It's always the same for your plan. Tiers 4 and 5 are co-insurance. And what that means is that instead of being a set dollar amount, it is a percentage of the retail value. And what you need to keep in mind with that is that can change because the retail value can fluctuate. And so if the pharmacy or the manufacturer raises the price, the percentage of that higher price will be passed on to you. And so that could change a little bit from month to month. All of the plans have $0 for 90-day mail order through Express Scripts for tier 1 and 2 medications. They also have $0 for 30 days of retail prescriptions for tier 1. So there are many drugs that are available for $0 copay. The coverage gap or donut hole that we hear about for 2024, that's going to start at $5,330. And the way they calculate that is even though you may be paying $0 for your copay because you're on a tier 1 or 2 medication, they look at the retail cost of that medicine and they keep putting it into the bucket. So maybe the retail cost is $50. So every time you fill it, $50 gets dropped in the bucket. So they're looking at what you pay and what your plan pays, and they're putting that into the bucket. And when you reach $5,330, you go into the donut hole or coverage gap. And at that point, you'll be subject to a 25% of retail costs. That's how much you would pay for your medication. And at the same time they're calculating that, they are also calculating what they call the true out-of-pocket costs. And once you reach $8,000, that is when you jump into the catastrophic phase that Kristen mentioned earlier. So if you have reached $8,000 in true out-of-pocket, and we don't have very many people ever reach that, but if you do, starting in 2024, once you've reached that $8,000 threshold, the rest of your medication for the rest of that calendar year will be $0 copay to you. Here's just some little information on the embedded benefits for the preventative embedded benefits in your plan. So all the plans provide dental, which is 2 cleanings per year and 2 exams, bite wing x-rays. And the key here, just like you always want to remain in network on the medical side, Delta Dental is the network that provides the best benefits for your dental preventative benefits. The key and vital plans, just a reminder, offer $0 for fillings, crown repairs, and extractions up to that $2,500 per year that's built into those plans. There's also vision benefits, preventative benefits embedded in your plan. $0 copay for a routine eye exam and 1 retinal imaging per year. You also have $0 annual glaucoma and diabetic retinopathy screenings. There's an eye allowance built into each of your plans, and it's kind of varies by plan, but it's anywhere between $100 to $175 to use for glasses, lenses, contacts. And again, the network to keep in mind for this benefit is iMed. There's also a hearing benefit built into each plan that provides 1 routine hearing exam per year. and affordable hearing aid pricing. Other than on the Vita plan, the other plans offer, depending on which type of hearing aid you choose, they range from $295 to $1,495. You'd get a free 60-day trial period, 1 year of unlimited follow-up visits, and 80 batteries for the year. And this is powered by True Hearing. That is the network that you would use to get these benefits. And again, just a reminder that on the Vital plan, there's the added benefit that you can get 1 hearing aid per ear per year for a $0 copay. Enhanced dental and vision benefits. We've kind of been mentioning that as we've been going along, but it's $33 a month on the Key and Vital plans next year, and $42 per month on the other plans. This can be added only certain times of the year. So right now, during the annual enrollment period from October 15 to December 7, you can add that on, and it would be effective January 1. They also have a grace period, and that you could add it in January or February if you somehow missed it during open enrollment or decided after the first of the year that you wanted to add the enhanced benefits. And the other time frame that you can do that is within 60 days of initially enrolling in your plan. With the enhanced dental and vision benefits, there's no deductible, there's no waiting period. Again, Delta Dental is the network. You get basic dental services, fillings and crown repair for a $0 copay, simple extractions, relines, and repairs to bridges and dentures at 50%, major dental services at 50%, and that includes crowns and root canals and implants. And again, that's a $2,500 maximum per calendar year. So if you were on that Key and Vital plan, you have $2,500 built into your original plan. If you got the enhanced dental, it'd be another $2,500 on top of that. The vision benefits that are built into the enhanced dental and vision, really, the enhanced dental and vision is more dental heavy, but it does provide a little bit of extra vision benefits in the form of $150 in additional eyewear allowance for frames and lenses and contact lenses. And just a reminder again, iMed Select is the network that the benefits flow best through. An eye exam and retinal imaging is included at no cost with an iMed provider. But you are able to, if you went to an out-of-network provider, you can submit it for reimbursement. Just not sure that if it would be covered at 100%. Some other embedded benefits that are part of your plan. You have a $0 copay for virtual care, and that includes behavioral or mental health. You have a no-cost physical exam and preventative benefits, and it's free to talk to your doctor. And really what that means is if you go to the doctor, you don't have to worry about asking a question that falls outside of the realm of a physical exam. You are free to talk to your doctor about anything and not worry that you're suddenly going to get charged a copay. That's not true in every other kind of plan. I know personally, I've had that happen to myself and to my children, that we happened to ask a question at a physical, and suddenly instead of a free physical, we had a copay that we had to pay $80, $100. And that was kind of surprising. But in your plans, you do not have to worry about that. You are free to talk to your doctor about anything you need to talk to them about. Priority Health also wants to make sure, in addition to taking care of things on the medical side, they want to make sure that your mind and body are staying healthy. So they offer some other extra embedded benefits, silver sneakers being probably the most popular benefit. I don't know if any of you are using that, but it is a great benefit to have a gym membership. And locally, I know a lot of, as Kristen mentioned, the MVPs are on there. The one other nice feature on silver sneakers is while you're exercising and keeping your body healthy, you can actually earn points that translate into tuition dollars for family members that are in a number of colleges and universities across the country. So if you want to look into that or give us a call if you have any questions, but that's a great opportunity to do something good for you and do something good for someone else at the same time. Brain HQ, it says a personal gym for the brain. And that's what it is. It's a way to keep your brain sharp. It's important, just as important as keeping our body healthy is to keeping our mind healthy and active. And it's just little games and puzzles and things to do to help stay sharp. And My Strength is the Health Club for Your Mind. This is just really a mental health support. One thing that did come out of the COVID pandemic is that we realized or remembered how important our mental health is, and that's just as important as our physical health. And so My Strength is an embedded benefit that you have that gives you access to folks that can help with depression or sleep issues or a number of other mental health issues. So really encourage you to look at that if that's something that you could benefit from. Acupuncture is also built into these plans, as is chiropractic care. In terms of chiropractic care, all the plans cover Medicare covered chiropractic, but some of the plans also add non-Medicare covered routine visits up to 12 per year. We've talked a little bit about over the counter, and we've seen the different allotments on our allowances on each plan. All the plans now have some form of over the counter benefit. Again, it's monthly or quarterly, and you use it or lose it. If you don't use it in that month or that quarter, it does not roll forward into the next. This can be used on health and wellness products like vitamins, aspirin, Band-Aids, any variety of allergy medication, different things. You can purchase it by phone, online, or in the store. And again, the big news is that Meijer is one of the stores that's now available this year. And I believe if you order online, if you order 3 or more products, the shipping is free. So there's a number of different ways to do it. There is a mobile app, and we've really heard great things about it, that if you take the app into the store, you can scan the product and it'll tell you right away whether or not it qualifies for your over-the-counter benefit. I'm not sure if anyone on the call is using that or not, but we've heard some really good things about that. And again, just a reminder that over-the-counter plus that's available on Vital, Key, and One plans can be used to buy healthy food and produce if you're eligible. Some additional embedded benefits that are part of your plan. Mom's meals. Following a hospital or skilled nursing facility discharge, when you're just getting home from the hospital and you're trying to jump back into life, to not have to cook is a very nice benefit. So Mom's Meals will provide 28 meals, 2 meals a day for 14 days. You can do this up to 4 times a year, and there's no additional cost to you. And we heard from someone this morning who had actually used this benefit. I don't know if anyone else on the webinar has, but he said the meals were actually very tasty. They were great meals, and that they will also take your dietary restrictions into account. So if you're diabetic or if you have salt restrictions, you just let them know, and they will create meals that fit within your restrictions, and they taste good. So that's really nice to know as well. And you can also, even if you're not coming off a discharge, if you would just like to buy a meal, you can do so for $7.99 per meal. And if you are one of the folks that is eligible for the OTC Plus, you can use your OTC allowance to pay for those meals. Papa Care, we've talked a little bit about that. That's another embedded benefit on some of the plans that helps with household chores and grocery shopping and companionship, and also some technical setup if you need help with that. And then lastly, the Wellbeing Hub. That is, it's an app that you can sign up for, and it helps you set some health goals for yourself. And more importantly, it rewards you for achieving your health goals, 2 of which being if you go to your wellness visit, you will get $25 in rewards. If you go to get your flu shot, and it's that season right now, I believe you get $15 in rewards. So just those 2 items is $40. And I believe you can get gift cards to things like Home Depot, to the movies, to different restaurants. So just by doing things that you already were going to do. So that's a nice benefit as well. And again, all of the phone numbers for these embedded benefits are available on that partner directory that was included in your packet. So this partner directory, and if you don't have one, you can contact us to get it. But that's got all of the extra benefits and how to get those. So now I'm going to turn it back over to Kristen, and she'll talk a little bit about the travel pass.
Card, and then you also get your travel card. So you're going to get 3 cards always every year. Again, if you do nothing, if you want to stay in your current plan and you just roll over into the next year, that's totally fine. It will renew itself, but just be aware that you should be getting those 3 cards in the mail. So what the Travel Pass does is it helps to navigate out-of-state travel benefits at in-network prices. So if you need to go see a routine services, such as a primary care physician or maybe a dermatologist, something like that, this is how you could use this benefit. You call the number on the back of the card to see who participates within your plan, and then they'll be able to help navigate that piece. So you can see any provider anywhere, but the Lower Peninsula of Michigan who participates with Medicare. This is a multi-plan network. So basically, I mean, they're helping you find providers who will then bill Priority Health directly so that you can seek that care outside of Michigan. Again, if you have an emergency, please go to the emergency room or urgent care because that is always included. And then the Travel Pass also includes this Assist America. So we were going to talk about what that looks like. So this is what the travel card looks like. Hopefully you've all received one. If you haven't, that partners directory, if there's any card that you don't receive, let's say it's the over-the-counter card. I've had that before with some clients. They, for whatever reason, didn't receive it. Call the number on the directory. They'll send you a new card. But this is what the Travel Pass looks like. Keep it in your wallet when you're traveling, or just at all times. The plan basically just is they're going to be able to help you find those Medicare participating physicians, even dentists, such as in the Delta Dental Network and commercial networks outside of Michigan and Indiana and Ohio. Again, we just really want to emphasize that you have the unlimited emergency and urgent care services. And then speaking to that AmeriAssist, and what is that? So Assist America, it's when you're traveling more than 100 miles away from home, you can use this service, and you can use it domestic or foreign travel. They'll help you coordinate anything. So you have a medical emergency, you call the number on the back of the card, and they'll help you navigate your situation. Let's say that you broke your wrist and you're in another country, maybe you don't know the language. I mean, they can help you navigate all of that. Again, you would go to the emergency room. We want to emphasize that, but then the additional care that you would need after, or if you need to fill prescriptions, maybe find another doctor since you're going to be there for a while. This is what Assist America can help you with. And they can even help you with lost luggage. So kind of a nice feature, because we all know sometimes that can happen when you're traveling. They do also, if you know where you're going to be going, you're going to be there for a while, maybe you need to see someone while you're there, or you need to fill a prescription while you're going to be traveling. They do have this pre-trip assistance, so you can get it set up and help you be prepared for your traveling. And then it must be a Medicare participating provider, unless, of course, it's an emergency or urgent care situation. However, you call that number and they should be helping navigate that for you. So the doctor and drug lookup. So these are the two websites that we suggest that you use, and we use them all the time when we, ask you who are your physicians, because we want to make sure they participate with the plan. What you're going to do is if you're going to go to the doctor one, you put in your area where you live, your zip code, and then you'll be able to determine which physicians, if you know their name or you're searching for a specific specialty or a facility, you can put all of that information and you'll see that on there, and they'll be able to tell you if they participate with the Priority Health Medicare Advantage plans. You will want to make sure that they do participate with Priority Health Medicare Advantage plans, because they will list out all of the plans. So you can search that on there once you select the person or specialty. And then they will also let you know if they're accepting new patients. Again, all about the networks. So this is a place too where you could search for the Delta Dental or your iMed. Sometimes it might actually make more sense to go directly to those sites as well, like Delta Dental or iMed, because there are different options with that. The drug formulary. So that one, if you haven't, let's say you have new prescriptions that are added and you're just curious, how much is this going to cost me on my plan? What tier does this fall under? So you go to this website and you put in your prescription and it'll pop up which tier it falls under. If you have tier 1 and 2 drugs on your plan and they're only tier 1 and 2, you do that mail order, it will cost you $0. So it's a good tool. This is something we use all the time to help our clients. So a little summary here. We really want to make sure that you're taking advantage of all of your benefits. Many are at no cost to you. So we hope that you're using them. For example, the over-the-counter, if you don't use it, it will fall off the card, but the next quarter it will go on, or the next month it will go on, depending on what type of plan that you did. But yes, use these benefits. They're built into your plan. Set up your member accounts. So that partners directory, again, is a big one to be able to set up Silver Sneakers or Brain HQ. And there's so many of them that you can be taking advantage of. And also make sure that you have your priority health plan, the medical piece set up. That way you can log in and you can see where your maximum out of pocket stands for the year. Look at balances, print invoices, anything like that. So we're already in our very busy season as we're in that AEP annual election period. However, we can't make any changes to the plan until October 15. So here we are next week already, and we're going to be in it. So October 15 to December 7th, this is the time for us to make those changes if you're interested, and they'll be effective January 1. If you want to add on your enhanced dental and vision, this is the time that you could do that. You can also take it off if you don't want it anymore. And maybe why would you want to change your plan? Maybe you want to move from a PPO to an HMO or the other way around. Maybe try, if you have a monthly premium on your plan, maybe you want to move to a $0 plan. These plans do change yearly. So if you make a change, you could change back again the next year because something will change again. So we are very busy. If you do want an appointment, please give us a call. Remember, we can do in-person, Zoom, or phone. If you already have an appointment, but based on the webinar and reviewing your annual notice of change that you received in the mail, you already know that you're good and you don't need to switch, then please give us a call so we can cancel that appointment and give it to someone else since our time slots are filling up so quickly. And then the other piece, just if you did want an appointment, remember we need that scope of appointment more than 48 hours before your appointment. So send it on right away. We're already starting our new process with that and obtaining those scope of appointments. So yes, thank you so much for attending today. We hope to hear from you guys. And if you have any questions, please give us a call. We are always here throughout the year, whether it's this time of year or outside of that annual election period. So thank you for being our clients, and we really appreciate all of your referrals as well.
Tune into Cornerstone Retirement Partners' full radio program, Your Course to Retirement, Sunday mornings at 9 o'clock at News Radio WOOD, or visit cornerstone-rp.com for many valuable resources, including those mentioned on this show and other great episodes of Your Course to Retirement.
The content of this radio show is provided for informational purposes only and is not a solicitation or recommendation of any investment strategy. You are encouraged to seek investment, tax, or legal advice from an independent professional advisor.
Ed Slott's Elite IRA Advisor Group is solely an indication that the financial advisor has attended training provided by Ed Slott and Company, passed biannual examinations on material covered at conferences and in webinars, and met other membership requirements, and does not constitute an endorsement of any kind. Ed Slott's Elite IRA Advisor Group members pay a fee for the educational programs that allow them to be included in the Ed Slott's Elite IRA Advisor Group. Membership does not guarantee investment success. Fiduciary duty extends solely to investment advisory advice and does not extend to other activities such as insurance or broker-dealer services.
Advisory services offered through Brookstone Capital Management, a registered investment advisor.
Advisory clients are charged a quarterly fee for assets under management, while insurance products pay a commission, which may result in a conflict of interest regarding compensation.
Any investments and/or investment strategies mentioned involve risk, including the possible loss of principal. Any comments regarding safe and secure investments and guaranteed income streams refer only to fixed insurance products. products. They do not refer in any way to securities or investment advisory products. Annuity guarantees are based solely on the financial strength and claims-paying ability of the issuing company. Withdrawals of growth from annuities may be taxable as ordinary income in the year it is taken. Individuals should review contracts for specific details of the product's features and costs. Early withdrawals may subject the owner to penalties, fees, or taxes.